Good afternoon. I'm Jennifer Dillaha, and it is my honor today to talk about what we have done at the Arkansas Department of Health to adopt health literacy. I've been at the health department for 16 years now, and I'm really proud of the progress we have made, and I'd like to share some of it with you. So first of all, to orient you a little bit to the health department, in Arkansas, we have what we call a unified health department. This means we have one state agency, and we operate 94 local health units around the state. In Arkansas, we don't have independent local, county, or city health departments. The main office where I work is in Little Rock, which is in the center there in Pulaski County. And to give you an idea of the population that we work with, in our state, we have almost 3 million people. We have a high poverty rate, and we also have a high rate of disability, and we have low education. And on top of that, we have only 64% of households that have broadband internet subscriptions, and that is the second lowest in the country. So we rank 49. And overall, we don't rank very high in terms of our health. So we have some really great challenges that we struggle with in Arkansas with regard to health. We also struggle with low health literacy in our state. So this is a map based on the algorithm that RAND developed from the NOW data. So the counties with the darkest green are the counties with the highest rates of low health literacy. And you can see that most of that is in the Arkansas Delta. Now let me ask you a question. Which counties, based on this map, would you guess have the lowest life expectancy? You guessed it. Pretty much the same counties. So even in the counties with high health literacy, we don't have less than a quarter of the adult population that don't struggle with low health literacy. So over the years, I have played a variety of different roles at the health department. I joined the agency in 2001, and in 2005 I became the director of the Center for Health Advancement. The health department has 4 centers, a public health lab, and then our agency administration. Those are the major units. So at that time I was director of the Center for Health Advancement, and I became aware that people in Arkansas struggled with grasping the information that was made available to them and using it to make decisions about their health. And I ran across this very interesting report that was put out in 2004 by this group called the Institute of Medicine, and it was all about health literacy. And that was my big aha experience. That is what health literacy is all about. So I prepared a Grand Rounds presentation. So every Thursday morning from 8 to 9 at the health department, we have a lecture that's given, and it's teleconference or video conferencing all around the state. And I invited a local pediatrician who had had training through the American Medical Association in health literacy. And we did a joint presentation on health literacy and defined it for our audience. And I promise you would have thought we had set off a slow bomb. It resonated, and the ripple effects have continued even to this day. So we spent the next year or two talking to everyone we knew about health literacy, what it is, what it entails, and finally in 2009 we just invited everyone we knew that was working on health literacy into the room to talk about it. And out of that came the Partnership for Health Literacy in Arkansas, which became the health literacy section of the Arkansas Public Health Association. And that has been our state coalition. We've had our ups and downs. We've been somewhat more dormant in the more recent years, but even now it's taking off again. So where there is a will, there is a way. What we found over time, though, were these realizations: that health literacy is more than just a literacy problem. You can be a highly trained engineer and still have health literacy issues. That the problem of low health literacy cannot be solved by providing more health information. And we also discovered that individual patients are not the only ones with low health literacy, that the health system itself, meaning also the public health system, has a health literacy problem. And so we started to look at it from the two sides of the coin. And we had great buy-in on that. So by the time 2011 rolled around, and we worked on a strategic map for the health department, our strategic plan, there was very broad consensus within the agency to add strengthening and integrating health literacy strategies into our overall plan for addressing high-burden health issues and strengthening and expanding the clinical services that we offer through our 94 local health units. There was very broad uptake to try to do that. And this was made possible because we had support from the highest levels at the health department to make health literacy an important part of what we do. So fast forward then to 2016, when we created a new updated strategic plan with goals in 6 different areas. We now had matured in our understanding of health literacy and the need to infuse it into everything that we did. So what we did was we made it part of the strategic planning process. So I know this is a little bit light and not the easiest to read, but basically we looked at our strategic map, we had our values and our missions, our vision and mission statement, and then we looked at the 6 goal areas, and those goal areas were to have objectives under each one of them. And every objective was to include strategies for addressing health literacy in those objectives. And that was a way that we found that we could take steps to include health literacy in all that we wanted to undertake as an agency. I want to say, though, that none of this would have been really possible if we didn't have high-level support in our agency through the Office of Health Communications. The director of the Office of Health Communication was an early participant in the partnership. And also at that time, the National Public Health Information Coalition also started talking about health literacy. And in the initial strategic plan, they took the lead on this cross-cutting strategy. And they provided the staff support that we needed to address health literacy in our agency. And this was really something of a challenge to our agency because we really didn't have dedicated staff. All of the health literacy goals and interventions have been added on to what people have already been trying to do. And that adds to the workload, and sometimes we have competing priorities that cause health literacy and our capacity building to be put on the back burner. So I want to talk a little bit about how we were trying to address that. So one of the things that we did early on was, we had a great desire to address health literacy, but, we didn't have a lot of capacity in terms of having people on staff at the health department who had a depth of expertise in health literacy. So we tried to give some thought as to how could we develop that in the health department. So we started what we called a plain language learning community. And initially, it was a project by Dr. Jimmy Parks, who was at that time a DRPH student. And with the support of the agency leadership, we asked the 4 centers, the lab, and administration to provide us with volunteers who later said they were voluntold to come to this group and look at health literacy, but more, at least for this purpose, through the lens of plain language. And it's one of those things in an agency or in organizations where you have some people who have a vision and understand it, and others who aren't quite there yet, and they struggle with why is this important. So that became the voluntold component. They had to be there because they were told to be there. And then the transition that the people on that group went through when they had their aha moment. And that was when they really realized the need for it. And the idea was for them then to take this perspective back and the training they had learned and use that in their part of the organization and encourage that kind of thinking and perspective. So this was such an important thing that even after the project ended in the spring of 2012, this group met with agency leadership and came up with some plans to implement more plain language. And that was that we really needed to take steps to integrate this with all that we're doing in the health department, and that we needed ongoing training opportunities. So the vision was that this plain language learning community would have people rotate on for 6 months or so and then rotate off. But the challenge was that we really needed someone who had staff time to oversee that kind of thing. And for years we have struggled with getting a funded position that we could do that. And I'm very happy to say that our Office of Health Communications now is in a position where we have an opportunity in the near future to recruit and hire such a person. So, like I said, where there's a will, there's a way. Another thing that we did is took funding that was available to us and used that for health literacy purposes. So the health department received funding through the CDC for the National Public Health Improvement Initiative. And we used that to improve health communication that the health department puts out. And one of our main examples of that is the combination state health assessment and state health improvement plan that we published in 2013, which we called Arkansas's Big Health Problems and How We Plan to Solve Them. It was a report that focused on life expectancy, infant mortality, and health literacy in Arkansas. And it was written using plain language principles, and it has been extremely popular. Dr. Smith, our director and state health officer, has stated that this is the most important document that the health department has produced in the last 5 years, because it became a paradigm shift and a model for what we need to be doing in the future. So produce reports like this is not easy, because many of our writers, being epidemiologists, some have background in health communication, but many have other background where they do not have the plain language skills that they need to produce these types of reports. And we have relied on our partners. One partner is the University of Arkansas for Medical Sciences, and they have helped us with training, but we would like to develop in-house capacity to also provide that training. And then there are other programs that we implement through the funding that we receive from federal agencies. So actually, in public health, many of the public health interventions that we do are at a core health literacy interventions. So a good example is the maternal, infant, and early childhood home visiting programs that we have implemented in Arkansas that was funded through Congress in about 2010. We have 53 counties that are served by these programs. There's 5 different models we use. They're implemented through our local health units and many of our partners. And the idea behind these programs is to provide individually tailored evidence-based education and information, as well as resources and support to expectant parents and families. And in a 2001 report, the Pew Charitable Trust found that well-designed and implemented home visiting programs show a $5.70 return on investment for every taxpayer dollar that's used for these. So I would say that in essence, it being a health literacy intervention, it's really very helpful to us. We have one of those models, Following Baby Back Home, which is a promising practice. It works on improving adherence to medical appointments and immunizations, facilitates coordination of health care, monitors child's growth and development, identifies the local resources to meet the needs of the family and infants, and promotes parent education. Does that sound like a health literacy intervention to you? It does to me. And for babies that are less than 2,500 grams when they're born that have been part of this program, the infant mortality rates for those babies under this program has been 8 per 1,000. For similar babies around the state that are not part of that program, the infant mortality rate is 52 per 1,000. And for children in this program from 0 to 18 months, their immunization series of completion for their immunization series is 94%. For the rest of Arkansas, it's about 50%. So it's really a wonderful intervention. So I do also want to give credit to some of our other funders. We have received a lot of encouragement support through Region 6 in the Southwest region to address health literacy. They have made it one of their priorities, and they've worked with our Family Planning, Women's Health, WIC, and our Office of Minority Health to address health literacy and implement health literacy-based interventions. So I'd like to take a moment to talk about one of them. It's called Sisters United, and it uses health literacy principles to reach out to African Americans in our state, particularly members of graduate sororities, to talk about folic acid before they're pregnant, flu shot when they're pregnant, and breastfeeding and safe sleep. And then now we have a Brothers United, and they talk about safe sleep and supporting the mom in breastfeeding. So we've learned some lessons. We have a lot to learn more still, but we realize, as in terms of organizational capacity, it's not enough to increase awareness of low health literacy. We really have to increase our skill level and personnel, and it's a challenge to have ongoing training within the agency as people rotate out of the agency. We have staff turnover and so forth. We also recognize that if we have efforts to change health behaviors and do not address health literacy, we'll be confounded. But also, we know that we're not likely to get a lot of resources to do health literacy in addition to what we have. So we have to learn to use our current resources differently. And the biggest challenge has been there have to be staff available to spend their time on these initiatives, particularly if we want to increase our organizational capacity. So I hope this gives you an idea of what we've been trying to do. I realize I haven't done justice to a lot of the activities the health department's done, particularly through our local health units, where they've learned to use Teach Back in the HIV program, and also with our WIC program that provides children's books so that parents can read to their children about some of the health lessons they're learning through WIC. So I'll stop now and can take questions later. So thank you.